So the question here is how to manage a patient when relapsed or refractory Hodgkin lymphoma is diagnosed. The refractoriness of the disease to conventional initial chemotherapy along with the stage 4 disease represented a poor prognostic factor in our patient. So the patient has a bad disease when she was defined as having a refractory Hodgkin lymphoma. Considering this, and also consider the young age of the patient and the good performance status, the standard therapy had to be as aggressive as we can, and should consist of a reinduction phase with the aim of achieving a complete remission, followed by high-dose chemotherapy and by autologous peripheral stem cell reinfusion, transplantation, the so-called autotransplant. The aim of this salvage therapy had to be to cure the patient. There are other options that can be discussed in patients with relapsed refractory disease. I don't think these options are good options in these patients. However, some very limited relapse, mainly if this appears sometimes after the initial treatment, can be offered a radiotherapy, local radiotherapy, or in some cases that are not eligible to high-dose therapy, a new chemotherapy program with a regular chemotherapy program, not including high-dose therapy, can be suggested. But in this patient, no doubt that the treatment, the salvage treatment, should consist of high-dose therapy plus autologous stem cell transplantation. This kind of treatment has different phases. The first phase is the reinduction phase that has the main aim of achieving a new complete remission and of harvesting peripheral blood stem cells. We decided to use an IGEV program that is a program that consists of ifosfamide, gemcitabine, venorelbine, and etoposide. There are other alternative regimens to IGEV that are currently used in different countries, in different institutions. These are the HAP regimen, the ESHAP regimen, the ICE regimen, and the IGEV regimen like the one we used. They are all good alternatives for the reinduction phase of a patient with relapsed refractory disease. I cannot tell which one is best among the currently available regimens because no randomized trial has been conducted comparing them one to each other. Then the choice of the reinduction regimen for a relapsed or refractory patient with Hodgkin lymphoma is actually based on the experience and on the preference of the center.